Hello, I'm Dr. Collins, and in this clinical examination video, we will explore a key diagnostic finding of acute appendicitis, known as Rovsing's sign. In acute appendicitis, patients initially present with abdominal pain that starts with referred pain periumbilically. As the condition progresses, inflammation spreads to the parietal peritoneum, and the pain therefore shifts to the right iliac fossa, where the appendix really is. Rovsing sign relies on the principle that when pressure is applied to the left lower quadrant of the abdomen, it causes the contents of the colon to shift and increase intraluminal pressure, stretching the already inflamed parietal peritoneum on the right, thereby eliciting pain in the right iliac fossa. To perform Rovsing sign, position your patient lying supine, with the abdomen exposed and relaxed. Gently but firmly palpate the left lower abdomen, applying steady pressure. In the meantime, carefully observe the patient and ask where the pain is felt. A positive Rovsing sign is when this palpation on the left lower abdomen produces pain in the right iliac fossa. Before we conclude this video, a quick word on the clinical value of this sign. Rovsing sign has variable sensitivity ranging from 20 to 75% and a specificity between 60 to 90%. So, on its own, it's not a reliable test, but when positive, it can increase your clinical suspicion of appendicitis. Thanks for watching. If you find this video helpful, please like and subscribe to fuel the passion to create more videos. And don't forget to check out our other clinical examination videos in our channel. Good luck!